Hey guys, it's Gabby from OCPT and just wanted to give you some guidelines on what to do in case you have recently gotten an epidural injection or injection into your low back or neck for pain. We always recommend getting into PT 2 days after the injection, but if circumstances are not allowing that, here are some general guidelines you can follow so that you can have the best outcomes. First thing is you don't want to use ice. I know it might be really tempting because you're really sore, but you don't want to do ice, and you can start using a heating pad after 1 day post the injection. So with the heating pad, you want to do it 2 to 3 times a day for 30 minutes max, because that's when your tissues reach peak temperature and you won't really get any benefit out of the heating pad anyway. And then you can continue that for 2 weeks and then as needed afterwards. And avoid NSAIDs. This includes Aleve, ibuprofen, Motrin, or naproxen. Any of those things, because you want the medicine from the injection to do the work. And you want to avoid other steroids as well, including cortico injections for at least 8 weeks status post the epidural. Now all of this is something to talk about with your MD that is performing the epidural injection, and these are again just general guidelines that we have found are the most beneficial. And as far as any other medication or supplements you may be taking, you should be okay to take them. Again, please consult the MD performing the procedure. In general, you can take Tylenol. You don't want to exceed the max dose or 1,000 milligrams. Then again, strongly encourage physical therapy, because even though that the pain may be better from the injection, if you don't fix your mechanics, then your daily habits of posture and movement will continue to irritate that area that has gotten inflamed or injured. And then a lot of times that's when we see people that go back for multiple epidural injections or need an injection at a different level. So again, consider physical therapy, because we're not just there for pain relief and massage, as nice as that is. We can help fix those postural bad habits that you might have, or movement dysfunction that cause poor mechanics within that joint segment. And here at OCPT, we also have pretty specific guideline and protocols of what modalities, if any, that we do right after the injection, as well as specific exercises and different phases to help you progress back to your normal activity. So I always get a lot of questions. These are the top 4 questions we seem to get when somebody is considering an epidural or just post-epidural injection. So first one is, what position should I be in right after? So for the first 48 to 72 hours, you want to be in the position that you find the most comfortable, because you will want to rest the area and rest your body to allow for the healing to work. So the second question we get are, what are my restrictions? So for the first 24 to 72 hours, you want the body to rest. Now that doesn't mean complete bed rest where you're not doing anything, but very gentle movement, nothing extreme or hardcore. So no bending, no lifting greater than 10 pounds, no aggressive twisting. If you can tolerate some walking, a gentle walk, no longer than 30 minutes, but no jogging, no running, no swimming, no step class or anything like that. And then you want to make sure that you are getting up every hour as tolerated, and while you're laying in bed or resting in your recliner, try to do some feet movement, ankle pumps, some heel slides, so to prevent blood clots from forming. The third question is, what will my recovery be like? Unfortunately, it's not going to be magic for the most part. You're going to have pain fluctuations for the first couple weeks, and then especially as you start to get back into more activity, you might notice that pain does increase a little bit, but that's why as physical therapists, we're closely monitoring that for you and really prescribing specific exercises on an individual basis. Even though we have a protocol or a guideline we follow, it really depends on kind of how you are as a patient presenting to us and what you can and can't tolerate and what your level of activity was before. in about 3 months' time, you should really find that you're back to the way things used to be for you and at a higher level of function than right at that injection point. And then the last question is, what should I expect? So obviously, we want pain relief. We want you to be able to take less pain medication and tolerate more activity, improve your strength, and just improve your overall function. And if you have any more questions, please seek us out at OCPT in Newport Beach. You can check out our website at ocptclinic.com. Subscribe to this YouTube channel to find out more information and get an idea of some of the exercises that you can be doing and that we would love to teach you at OCPT.